I'm Robin Marshall. I'm on the air at K104.7, and I have somebody very important to introduce you to, Dr. David Klein of the Renaissance Plastic Surgery Center.
Glad you're here.
Me too, because you have a lot of stuff to share with all of the listeners, whether it's men, women, that are interested in different procedures.
Oh, absolutely. I think people of all ages and both sexes certainly are interested in appearance. You know, that's health and appearance now.
Right.
And health is really important in taking good care of yourself.
You're right.
Which dovetails into then how you look. And the longer you take care of yourself, the longer you look it.
So now a couple of the things that you do, we're going to talk about face care.
Mm-hmm.
We'll start there. Facials and skincare products and things. Is this part of your skincare line?
Yes, it is. I have several lines. Mainly, it's educating you on how to take care of yourself. It all starts at home. It starts with you knowing what to do and what not to do. We have several different lines of products. The products aren't as important as which ones you use. The lines aren't as important. If what you use from home that you get at the department store works for you, great. Mm-hmm. We just want to make sure you're using it properly. And so we have skincare in the office. And that's basically our first step with everybody that comes in for facial discussions. It's not all about the surgery. Mm-hmm. It's about taking care of yourself before the surgery, during the surgical period, and after the surgery.
And determining whether you even need the surgery.
Correct. We have lots of options.
Explain the difference, because there's a lot of people out there that are confused. I was confused between fillers and Botox.
Right, right. Okay, Botox is botulinum toxin, which inhibits the nerve impulse from making your muscles move. So when you have wrinkles from frowning, it's these muscles that are contracting that fold your skin, essentially. If you fold that skin long enough and as many times as you do, they're going to have a crease. So if you relax that muscle, that crease softens and it's not as obvious. It blocks the nerve impulse and essentially temporarily weakens and paralyzes the muscle.
It doesn't hurt?
No.
I mean,
you don't even know it,
no,
actually.
Okay.
You think you're frowning at your kids and your eyebrows are moving.
Which makes for better family living.
Absolutely. You can be mad, but nobody will know.
And where would you normally put Botox? Just in the forehead area?
Typically in the transverse forehead lines, the frown lines, and then the crow's feet lines. Mm-hmm. And those are the three common areas.
And then what are fillers?
Fillers are a different topic altogether. They actually are a bulking agent, if you will. If there is a crease, think of it as a pothole in the ground. You have to put something in to make that road level again. And in a crease, you want to fill it up with fillers. So there are several different types of fillers: hyaluronic acid, calcium hydroxyapatite.
It's a difference.
Longevity and how they work, and also where you can put them. Some people have very sharp, very superficial creases, say from sun damage. A certain type of filler works better there. Someone may have just a structurally deep trough in their nasolabial folds, and a bulkier filler works there, and it goes into the deeper tissues. So it really has to be customized for everybody. Not, one size doesn't fit all when it comes to fillers. And you really have to sort of see the patient's desires, the different areas that they need it, and their type of skin and complexion.
Is that the same thing that you would use for the lip plumper that they sell on TV?
Right.
Would it be fillers
It is fillers, and most of those are off-label uses, meaning that we put the FDA and the companies sort of research a specific body part that you can do that on. But if it works in one area of the body, it typically works in another. It's just that, we always have to tell the patient what the company's recommendations are. Certain fillers I will not put in the lips because they just simply will cause too many problems. Other fillers I will, because I've used them for years and years, and judiciously used. They're perfectly safe and perfectly fine and give you a look that's normal.
Right.
The big Angelina Jolie lips are not as much in style as they were 10 years ago, and so people want sculpting, so it's really very precise and very fine sculpting of the lips that gives them shape now.
What is the average age for a woman to begin looking for Botox or fillers?
Well, I think I see some folks in their 30s, typically their later 30s, the 30-somethings. Certainly in the 40s, I think people are starting to develop creases. The collagen and the texture of the skin is getting a little more worn and weathered, and also the elasticity is starting to give up a little bit. So a lot of my Botox and filler patients are in those younger categories because they're really not ready for surgery, and surgery would be too drastic and really unnecessary.
Do you have cases of women coming in saying that they would like to have a facelift, and you see that they really just aren't ready for it?
Routinely.
Isn't that something?
Yes,
Really
yes.
something.
People come in all the time, I need my eyes done, I need my neck done, what have you. Once I talk to them and once I tell them that surgery is not combing your hair or coloring your hair or getting a haircut, it is real, and it has permanency, it has risk, and it has downtime. Fillers, Botox, you're fine the next day. I mean, you can go about your business sometimes that afternoon if you don't swell and so forth. But yeah, I talk a lot of people out of surgery just because they really don't need it, and I try to educate them. If I educate them now, hopefully when they do need their surgery, I'll be here in 5 years when they need it. They'll come back to me.
It's that customer service, the
Absolutely.
caring in you. That's very commendable. Explain aging laxity. Is that the right word?
The laxity of your skin?
Well,
right.
When does that start to break down? Is that the same thing that you were saying is usually 35, 40 years old, or is it?
Sure. I think we start seeing that, and what it really is if you think of your grandparents and you touch their cheek versus touching your nephew's cheek, very different texture.
Right.
The older you get, the thinner your skin typically gets. And that is the thickness and the resiliency, and then also the elasticity. So when you pinch a baby's cheek, it goes right back to normal. If you pinch grandma's cheek, it might take a little while for it to go back up. And so I think when that elasticity turns lax or becomes lax, then you start getting skin that is hanging off of your face.
Right.
The neck, the jowls, the bagging eyelids. And those type of things then do require surgery, because no magic creams, no magic massage, no springs you put in your mouth and exercise your cheek muscles.
Right.
None of that works. And so when it's right, surgery is right. Judiciously used, works very well.
So, how do you think I look?
They do it great. Of
Well,
course.
that's good, because this man did the work on me. I came in saying, well, what can you do for me? I need something. I just, I wasn't sure exactly, because I was a little frightened at first. I had never given it any serious consideration at all. But I looked in the mirror one day and I said, well, maybe I'm due for something. And I said, what is it a facelift I'm looking for? And you almost laughed at me.
Sure.
You said, no, you could use maybe a little liquid facelift.
Right.
That's what you called it. So you explained, and I'm speaking from firsthand, knowledge, being with this man in that situation. And he walked me through, talked me through, highly suggested, followed through afterwards, had his staff call me to make sure I was okay, and brought me back in just to take a look, to make sure that the work was done, or it was done properly, but you wanted to see the after effect.
Absolutely.
So
I want to make sure that, particularly when you're educating someone and they don't really know what it's supposed to look like because they've never had it before.
Exactly.
Well, I sort of do, and so I want to make sure that it worked out as best as it could for you, which is important whether you're doing surgery or something minor like fillers, because some people don't know, and then it may be something that I can fix with just a little massage or a little teaching, and they may not even notice that. They may not be happy and not want to call me and tell me, but face to face, once you see me, you can talk to me.
thank you so much.
Thank you.
Dr. David Klein. Take a good look at him. He's a good-looking man. He takes care of himself, so you know he's going to take care of you. I'm Robin Marshall with K104.7.